Welcome to On-Demand Learning with Michigan State University College of Nursing. This activity is part of the Help Pain series. This is part 1. This session is 0.5 contact hours of nursing continuing education credit. Michigan State University College of Nursing is accredited with distinction as a provider of nursing continuing professional development by ANCC. The learning outcome today is that upon completion of this learning activity, participants will state increased knowledge of assessing pain-related functioning and apply cognitive and behavioral strategies to address pain in pediatric patients by achieving 80% or greater on the post-session evaluation. Criteria to receive contact hours for this activity are viewing the learning activity in its entirety, complete the post-session evaluation with a score of 80% or greater, complete the survey following the post-session evaluation. Following the completion of the evaluation and payment, if necessary, an electronic contact hour certificate will be delivered to the email address that you provide.
My name is Natasha Cunningham, and I'm an associate professor in the Department of Family Medicine at Michigan State University and a licensed pediatric psychologist. Today I'll be talking about cognitive and behavioral strategies that providers can use to support children with pain symptoms. Our program is called the Help Pain Program, and today I'll be presenting on part 1 of a 4-part series. The objectives of today's talk are to learn different ways to assess pain-related functioning in youth and to apply cognitive and behavioral strategies to address pain in pediatric populations. We'll also talk about recognizing the importance of good sleep hygiene for pain management and learn strategies for how to improve sleep hygiene skills. Pediatric chronic pain is a common problem impacting many youth. The case of Emily is a frequent type of example we see in pain management. She's a 10-year-old girl who attends elementary school in Michigan and has been complaining of frequent headaches that are getting in the way of her life. She's having difficulties riding the school bus due to her pain symptoms, and her headaches are becoming more frequent, especially if there is a big deadline, such as a test or a class project that is due. Sometimes she also experiences belly aches. At school, she's constantly going to the front office and is sent home when she experiences pain symptoms. She's also struggling to concentrate on her assignments and has gotten behind in math. Emily used to participate in ballet but has stopped going to practice because of her pain symptoms. Performing recitals have gotten particularly challenging. She's also missing out on fun activities with friends and family. Her family recently canceled a planned outing to the zoo due to her pain symptoms. She and her family are frustrated by how her pain is affecting her life. Pain in school children is extremely common and often underestimated and underreported. There are many strategies, cognitive and behavioral, that can be employed to help support youth struggling with common pain complaints such as headaches, belly pain, and musculoskeletal pain. Between 10 and 20% of all youth experience chronic pain conditions. They are associated with a number of poor outcomes, including poor academic performance, co-occurring mental health concerns such as anxiety and depression, and social difficulties. Chronic pain in youth is also associated with an increased risk of substance use disorders in adolescence and in adulthood. School nurses in particular may play an important role in supporting youth with pain symptoms. In fact, 1/3 of all school nurse visits are for pediatric pain complaints. Although pediatric chronic pain is extremely common in youth, School professionals, including nurses, experience several challenges related to managing these symptoms. School nurses report that although this is one of the most common complaints they treat, they have limited training in the causes of chronic pain and in using non-pharmacologic approaches for managing pain symptoms in youth. We know, looking outside in other disciplines, that cognitive behavioral and mindfulness meditation strategies can be helpful for pain management and can be administered by nurses and other providers who are appropriately trained. An important first step to effective pain management involves using standardized screening methods to track impairment. It's important to utilize standardized screening methods because this allows providers to assess functioning in a standardized way and understand if the strategies employed to support children are working. A goal of pediatric pain management programs involves restoring functioning. Reducing pain symptoms is a secondary goal. To use the screen tools, we recommend administering and reviewing the results, including with the child at regular intervals. This can include describing the measure, what it means, and the results. Brief tools may be the easiest and most realistic to employ, particularly in school settings. Use of such tools allows for tracking of progress, including any setbacks that may happen during care. First, we'll talk about tools that are related to pain-related functioning. A clinical global impression scale completed by the provider can be a useful metric for tracking impairment. A provider may ask themselves, considering one's total clinical experience with children in pain, how much is this child impacted by their pain symptoms at this time? The benefits of using a provider-reported measure is that it's easy and accessible to use. The cons are that it's not a child report. This data piece can be one of several helpful units of information to support care of youth with chronic pain. The Functional Disability Inventory measures physical impairment over the past several days. It is a child-reported measure consisting of 15 items where youth indicate how much pain gets in the way of day-to-day activities. There are clinical cutoffs indicating mild, moderate, and severe symptoms. We note that in school settings, most children with pain may present in the upper range of mild impairment. Here's an example of several of the items that are included in the Functional Disability Inventory, or FDI, and the instructions that a child can read prior to completing the items. There are several considerations that should be taken into account when weighing whether or not to use a measure such as the FDI. This measure was validated for children ages 8 and up, so it may not be appropriate for younger youth. It is intended for English-speaking individuals. The benefits of using measures such as the FDI is that children are oftentimes the most accurate informants of their own symptoms. Provider measures can also be useful because they're easy to administer, and they also may be more appropriate in instances where youth are unable to report on their own symptoms. If possible, a combined approach utilizing multiple informant data is ideal. This is an example of one child's data over the course of receiving psychological care for their chronic pain symptoms. As you can see, over the course of an intervention, the child went from severe symptoms to symptoms in the mild range of impairment. Tracking data and sharing results with children can be very meaningful to align people and make sure everyone is on the same page in terms of progress and setbacks and steps towards augmenting care. There are other pain-related measures of impairment that may also be useful to assess functioning. School attendance is a very important metric, which may include absences, but also lateness and early dismissal due to pain. Frequency of unplanned school nurse visits would be important to collect. Mental health support visits. When getting data on these sorts of items, it's very important to ask if the reason for the visits was because of pain or not, and if the visits were planned versus unplanned. There are many tools that are available that can be effective for helping to support a child struggling with chronic pain. Cognitive behavioral therapy and mindfulness meditation strategies have good evidence of support in pediatric pain populations. One cognitive strategy that can be effective for helping to support a child in managing chronic pain is identifying and addressing negative thoughts surrounding pain. Negative thoughts can have an impact on how children experience pain. Once negative thoughts are identified, you can work with the child to talk back to those negative thoughts, close the pain gates, and diminish the impact of those negative thoughts on a child's pain experience. Some examples of some more positive and realistic thoughts a child can tell themselves is, I'm going to be okay. I will do my best to get through this. I can ask for help. Here's how to reframe negative thoughts related to pain with children. The first step is to identify common negative thoughts the child experiences related to their pain. Examples of this might be, I can't handle this pain, or the pain is terrible. Work with the child to identify more positive and realistic counter thoughts, such as my pain won't last forever and I will be all right. We encourage children to have these more positive thoughts available visually to them, either on a note card, in their wallets, in their phones, to help prompt them to think of their more positive counter thought. Another strategy that can be helpful for both pain reduction and general stress management is deep breathing. Providers can encourage children to breathe in through their nose, hold, and then exhale through their mouths. Their abdomen should increase and decrease in size as they take deep breaths. Effective use of this strategy can reduce heart rate, blood pressure, and help combat racing thoughts. Another strategy that can be helpful for children is mindful breathing. This strategy differs from deep breathing because a child would breathe as they normally do. They would focus on their breathing, noticing where the breath originates and how it travels in their body. As they get distracted, you as the provider can encourage them to refocus on their breathing. Guided imagery is another relaxation strategy that can be beneficial for youth with pain and other symptoms. In this strategy, a provider can help a child think through a place that they find relaxing, such as the beach, other scenes in nature, or maybe even in the comfort of their own home. And walking them through all 5 senses, a provider can help the child to imagine this relaxing place. Before and after using any of these relaxation strategies, it's important to ask a child how much pain, tension, and worries they're experiencing. You can use a 0 to 10 scale. If they don't currently report any of those symptoms, you can ask them to rate how relaxed they're feeling, and then reevaluate after each strategy to see if you can measure changes in their symptoms. You can also ask guiding questions such as, what was your experience? What were some challenges you faced during this exercise? It often may take several sessions of working with a child before you see changes in their symptoms. It's also most effective to practice these strategies before a child is in an active pain flare so that they can attain some comfort with the strategies prior to using them during an active pain episode. We'll also talk a bit about sleep hygiene, which is very important for children experiencing chronic pain and just generally is important for pediatric and human wellness. Many children experience poor sleep patterns. This might include undersleeping, frequent naps, dysregulated sleep patterns. This may all contribute to areas where effective sleep hygiene strategies can be employed to support child sleep. To identify areas where a child may benefit from utilizing sleep hygiene strategies, the first step is assessing their current sleep habits. Ask a child what time they go to bed, how long it takes them to fall asleep. What is the quality of their sleep? Are they waking up a lot during the night? Are they sleeping fairly soundly? What time do they wake up in the morning? How many hours of sleep are they getting during the week and on the weekends? Are they taking naps? And if so, how often and how frequently? Where are they sleeping? Do they have access to their own bed? And what are they doing before bed? What is their wind down and bedtime routine? It's also helpful to know if a child is waking in the middle of the night. What do they do? Do they just lie in bed? Do they get out of bed? How long does it take them to fall back asleep? It's also helpful to understand a child's current level of caffeine consumption, their general activity level, and if they're currently using any sleep supplements or sleep medications. Depending on what the assessment reveals, you can recommend some sleep hygiene recommendations. We encourage starting small, 2 to 3 recommendations to not overwhelm the child and their family. These may include encouraging a consistent routine for bedtime. We really encourage kids to try to go to sleep at around the same time every night. We appreciate weekend and weeknight routines vary, but we encourage kids to get as close as possible to similar sleep and wake times. We encourage doing quiet activities before bed rather than doing things such as engaging in social media or playing on their phones. If a child wakes in the middle of the night, we recommend that they identify a quiet place they can go to where they do something really boring, such as reading a really boring book to encourage drowsiness before going back to their bed. Beds should only be used for sleeping. We also encourage that children don't do anything but sleep on their beds, so no studying and no screen use. We encourage children don't eat 2 hours before bed. And if a child is a worrier and it's keeping them up at night, we suggest a journal of possible worries that they write down to help put those worries aside to encourage a good sleep cycle. If a child is currently sedentary, increasing physical activity can support good quality sleep. And consider using some of the relaxation strategies into a bedtime routine. Decreasing daytime naps is also important. We really discourage any napping, but if it is needed, we limit naps to 30 minutes. It might be helpful to just even pick one aspect of sleep hygiene to target. Here are some examples. Michaela is a 16-year-old girl who's experiencing both chronic pain and constant exhaustion. She has poor sleep hygiene and has been falling asleep in class, and it's frustrating for her teachers and impacts her performance. She admits she doesn't get a lot of sleep and doesn't fall asleep until 1 a.m. or later. Her nighttime routine includes using social media on her phone to help her relax, and although she goes to bed very late, she has to get up at 5:45 a.m. to catch her bus to school. Since she's getting very little sleep during the week, she's using the weekend to catch up on sleep she misses. Think for a moment, what ideas or suggestions would you offer Michaela based on what we've learned? What challenges do you anticipate to Michaela using these strategies? And what are some potential solutions to overcoming those barriers? Some additional closing questions to consider are as follows. The first is, are you currently using any pain management strategies in your practice? And if so, which strategy or strategies do you use? Will you use any of these strategies we talked about today going forward? And if so, which will you use and why? Are there some you're less likely to use? And for what reasons would you elect not to use certain strategies over others? And lastly, how will you use these strategies? Thank you very much for your time, and if you have any follow-up questions, please feel free to reach out. These are the references for your knowledge.
Thank you for joining this professional development continuing education activity. Please scan the QR code with your phone or use the link provided below. Your continuing education certificate will be provided electronically to the email that you place within the survey following a successful pass of the post-test at 80% and submission of the completed survey. Thank you again for joining us.